cancer, the treatment and the preventive recommendations. With me in the studio is Dr. Sredharan M. Dr. Sredharan has done his MBBS and MS at the Madras Medical College and went on to specialize in surgical oncology at the Tata Memorial Hospitals, Mumbai. Welcome, Dr. Sredharan, to the show.
Thank you.
So, doctor, before we, jump into all the nitty-gritties of cervical cancer, what exactly is the cervix and what is its function in the human body?
Okay. Cervix is the lowermost portion of the uterus or the womb. So, during pregnancy, this the cervix that remains closed and it helps a baby to form safely inside the uterus.
Right.
And during childbirth, this portion of the uterus, the cervix, it dilates and opens up, allowing the safe passage of the baby through the vagina. So, this is the portion of the body which connects the uterus to the vagina.
Right. So, doctor, what is the general statistics of cervical cancer now in the recent era?
Okay. The cervical cancer is the second most common cancer among the Indian women, next only to breast cancer. So, according to the Globocan data, which monitors the incidence of cancer among different population group, different cancers among the population group, it mentioned that nearly 4 lakh women are affected every year worldwide because of cervical cancer. Okay. Among this, Indian women, 77,000, approximately 77,000 Indian women die every year because of cervical cancer. This accounts for almost 1/4 of every death of cervical cancer that is reported all over the world because of cervical cancer. So, cervical cancer is one of the common cancers that we deal with in our OPD basis.
What are the common causes of cervical cancer?
Okay. The cervical cancer is unique when compared to other cancers. This is because it is most of the cervical cancers, around 80 to 85% of the cervical cancers is caused because of a viral infection. The viral infection called human papilloma virus. The human papilloma virus is a sexually transmitted viral infection. Almost all the male and female who are sexually active at one point in their life is infected by this virus. It is a type of virus which gets, after infection, it gets incorporated into the DNA of the body of the person that it infects. So, if the immunity of the person is good and the person develops the immunity against this viral infection and the viral infection remains dormant. So, in some cases, in around 15 to 20% of cases, in case the virus is more virulent or the immunity of the person who gets infected is not that good, then the viral infection becomes persistent. So, the viral infection remains there for some time, causing small discharges over a period of time. So, when this viral infection persists for more than 5 to 15 years, then this viral infection can lead on to what is called a precancerous stage. Then slowly this precancerous stage becomes increase in size and they cause cervical cancer.
Right. So, HPV infection is the only cause of that leads to cervical cancer, or there are many other causes as well?
So, as I said, more than 80 to 85% of cancer can be attributed only to this human papilloma virus infection.
Right.
So, any factors which increase the risk of this human papilloma virus exposure, such as like early sexual activity or having multiple partners or having a person with having sex with a person who has a known sexually transmitted disease, it increases the risk of cervical cancer. Apart from this, there are people who take contraceptive pills. Okay.
Right.
So, in utero, suppose the person doesn't know that they are pregnant and they are continuing with the pregnancy while taking the contraception, it also can increase the risk of cervical cancer in the child that is born.
Right. So, doctor, what would be the symptoms of anyone who would be in a precancerous cervical cancer stage or already suffering from the disease?
So, when we look at the symptoms of cervical cancer, the most common symptom that a cervical cancer patient suffers from is abnormal bleeding. This abnormal bleeding can be exhibited in the form of presence of bleeding after the menopause, such as postmenopausal bleeding, or the bleeding can be in between the periods. The vaginal bleeding can be in between the periods or after a sexual intercourse. This bleeding can be either painless or it can be associated with the lower abdomen pain. So, sometimes the patient may not feel any bleeding or they may have what is called a white discharge. White discharge, especially when it is foul smelling, it is imperative that you go to the doctor and get it tested for cervical cancer.
So, doctor, is there a predominance of a particular age group in cervical cancer? or it's just generally spread to the entire age group in women?
So, as we discussed before, the most common cause is because of the human papillomavirus infection, and the infection takes around 5 to 15 years for the cancer to develop. So, when the sexual activity starts, so usually it's around like 25 to 30 years of age, and after that, when we see some 10 to 15 years, say the cervical cancer incidence starts by around 40 to 45 years of age. Then at peaks, it goes on to increase till the age of 60 years of age, till the menopause.
Doctor, how would you prevent a cervical cancer in women?
Cervical cancers is one of the few cancers that can be prevented with the help of vaccination. So it is one of the only two cancers that can be prevented with the help of vaccination. This vaccination is 97% effective against the human papilloma virus. This should be given in an age group of 9 to 14 years of age. Only 2 doses are sufficient, given on 6 months, given in with a difference of 6 months. This is like more than 97% effective in preventing the human HPV infection, thereby preventing the risk of cervical cancer development.
Right.
So this, if the child has missed the injection at 9 to 15 years of age, between 16 to 24 if you are giving, then 3 doses of injections are necessary. So one at day 0, the another one at first month, the another one at 6 months of duration. So 3 doses are necessary. Previously, this type of vaccine was produced only in US. That vaccine used to cost around 11,000 rupees. Per dose used to cost around 11,000 rupees. So recently, the government of India initiated a indigenous development of this vaccine, and that vaccine is developed at a much cheaper rate of around 2,000 rupees per dose.
Per dose, right. So, doctor, how would you diagnose cervical cancer? What are the different tests that can be done to do the diagnosis of cervical cancer?
Okay, once there is suspicion of cervical cancer, there are two main different types of tests that are done. One is to establish the diagnosis of cervical cancer. One is to prove that the person has a cervical cancer. So for that, it is done either a biopsy test is done. So it is generally done under a IV sedation. So a piece of the tissue from the cervix is removed and then sent it for testing. This proves whether the person has cervical cancer or not. So once the cervical cancer presence is proved, the next test that we do is to stage the disease. What is the stage of the disease and how far the tumor has spread. So for that, the doctor generally asks for either a MRI scan or a combination of a MRI and a CT scan. This gives an idea of the stage of the disease as well as helps in planning the treatment.
Doctor, what would be the treatment in case of cervical cancer?
So once the cervical cancer is proved, the treatment depends upon the stage of the disease. There are 3 treatment types, major types that are available for cervical cancer. First and foremost is surgery, and the second is radiotherapy, and the third is chemotherapy. In surgery, the cervix along with the entire uterus and upper portion of vagina is removed and then sent for testing. In radiation, the radiation is sent from outside and then to treat the cervical cancer.
Area,
yeah. In early age stages, in stage 1 and 2, surgery with or without radiation or a combination of these two is given in the early stages. In case of advanced stages, the main treatment will be chemotherapy with or without radiotherapy.
Doctor, would you like to tell our viewers more about the screening of cervical cancer and how do we go about in preventing cervical cancer?
So, a screening test is a test which is done before the development of symptoms. This is done to identify cancer at the earliest stage that is possible. That is called a screening test. So, in case of cancer cervix, the screening tests that are available are, one is called a pap smear test. The other is a HPV DNA test, which identifies the presence of DNA of the human papilloma virus in the human body. These two are the two main types of tests that are available. In pap smear, a specialized brush is used to scrape some cells from the cervix and then it is sent it for testing. So this is entirely painless and it can be done on a OPD basis. So once this test comes negative, say it doesn't show cancer, this test can be safely repeated after a period of 3 years. So in case of HPV DNA, apart from this pap smear, they also check for the presence of HPV DNA in the sample. So if this test comes negative, this can be repeated once in 5 years. So this is done usually between the age of 25 to 60 years of age. is done to identify the cervical cancer at the earliest stage.
Right. So from the age of 25 years, every woman has to do the pap smear and then repeat it every 3 years.
Yes, it is advisable that all the women that are sexually active, even the ones that is vaccinated, to preferably to undergo a test, a combination test of pap smear along with the HPV DNA once in 5 years till the age of 60 years.
Right. So, Doctor, recently the government of India has announced HPV vaccination as a part of their, vaccination program. Could you tell our viewers more about the importance of this vaccine and how it should be taken?
Yes. In 2018, the World Health Organization announced that a cancer that can be prevented by vaccination should be eradicated by the year of 2030.
Okay.
With this in the target, with this as the main target, it set out three important sub targets. So it is called the 90, 70, 90 target. Okay. So in which 90% of pre-sexual activity girls, they should be vaccinated against human papilloma virus. So 70% of all women should undergo screening for cervical
HPV,
cancer. Yeah. And 90% of women with cervical disease should receive some form of treatment. So this was a 90-70-90 program. So with this in mind, the government of India initially initiated the production of indigenously developed human papilloma virus vaccination. It is called the Cervavac vaccine, which is considerably cheaper than the US counterpart. So this cost around 2000 rupees per dose. So this dose is recently the government of India has announced that this dose of vaccination will be incorporated into the immunization schedule of the girls between the age of 9 to 14 years of age. So once implemented, this vaccine will be given for free in the age group of 9 to 14 years of age.
So doctor, if a woman or a girl has not received the vaccine from the government's immunization program, is it possible to take the vaccine anytime in your life, or is there a particular age group that has to be taken in that time only?
So under the government immunization schedule, it has to be taken between 9 to 14 years of age. But if the immunization schedule is missed, or you have already crossed the age of 14 years of age, till 26 you can take 33 doses. It still is effective. Okay. So what about the older woman? Recently, the studies have showed that the vaccination is not as effective as it is in young girls who are like given vaccination before the HPV infection happens. Because the way the vaccination works is it acts by preventing the HPV infection. So once the HPV infection has already happened, it is not that effective. It is not that effective.
Yes.
Okay, because the previously occurred infection is going to be there. So, but the recent studies have showed that human papilloma virus has over 100 different strains. So even if person is get infected by one strain, the vaccination can be efficient in the other 99 strains.
Yes.
So vaccination is still advised till 45 years of age. Although not covered under the immunization schedule, they can take until 45 years of age. So 3 doses needs to be taken. So even though it is not 100% effective in preventing the cancer, it can still provide some sort of protection against the cancer.
Right. So doctor, could you explain to our viewers what is the surgical approach in the treatment of cervical cancer?
Okay. So for cervical cancer, during surgery, we remove the portion of the uterus and the cervix and the upper portion of the vagina, which carries the infection. Apart from this, the surrounding lymph nodes to which the cancer might spread, that is also removed and sent it for testing to get a better idea of the final stage of the disease. So this is how usually the surgery is planned.
Done. Right. Doctor, since this cancer is very rampant in the younger age group of women, what would be the fertility of the women after cervical cancer? Is there any chances that they can conceive and go ahead with full-term pregnancy? Okay.
So during surgery in cervical cancer, if it is not identified at an early stage, we will have to remove the entire uterus along with the ovaries and the cervix. Right. So the chance that they can conceive after that is nil. They won't conceive after the surgery. Right. So if the person wants to conceive after the surgery, what they can do is they can go for surrogacy.
Right.
They can preserve the ovum which is taken before the treatment, and they can cryo preserve it, and that can be used later with in vitro fertilization and surrogacy.
Right.
So in case of very early stages of cervical cancer, especially those that are like diagnosed during the screening, what we can do is a fertility preserving surgery, in which only the portion of the cervix, the small portion of the cervix which is infected by the cancer, is removed.
Removed.
The procedure is called either a conization surgery or a laser excision surgery. That can be done, and that can help the woman to carry on with the pregnancy, at a later date.
Right. So, doctor, as we come towards the end of this episode, what would be your take-home message to all our viewers with regards to cervical cancer?
So, with regards to cervical cancer, just in any other cancer, do not ignore your symptoms. Especially with regard to cervical cancer, there is always a sense of fear, a sense of shame regarding coming out with the symptoms. So, the most important thing to remember is, as any cancer, when diagnosed at the earliest stage, the treatment is much less invasive with very minimal side effects. And the cancer can be completely cured with a near normal lifespan for the individual. In case of cervical cancer, the fertility can be preserved if found at a very early stage.
Right.
So, and the treatment can also be much less expensive, especially when compared to found out advanced stages. So, do not ignore your symptoms and always consult a doctor when you have any suspicion.
Right. Thank you, Dr. Sredharan, for taking time out and explaining to our viewers the importance of getting diagnosed for cervical cancer, getting screened, and also getting vaccinated. Dr. Sredharan is available at Manipal Hospitals, Goa from Monday to Saturday for consultations. Keep watching Prudent, stay fit, and take care.